Since the beginning of January 2015, the number of Ebola cases continues to decline in Sierra Leone. Nevertheless, vigilance remains high, especially in Bombali district, a former hotspot. Monitoring teams meet every morning at the city hall in Makeni, transformed into the command center for the fight against the Ebola virus. These young people are for the most part medical students. When all the schools were closed in June 2014 because of Ebola, they decided to join the health department's monitoring team to track down the virus in the communities. Francis is one of them. He is the leader of Team 5.
Currently, we have 8 surveillance teams who are assigned to various chiefdoms. We have 13 chiefdoms in the district. So in the morning, we ensure the alerts that come in overnight are given out to these teams based on the zones in which they have been placed. The moment that is done, we expect monitoring to start immediately and the quarantine team to do an assessment which normally lasts for a day or two before a decision is made on compulsory quarantine or monitoring, as the case may be.
Instantly after the briefing, all the teams headed out into the field in order to track down all of the reported cases. Team 5 is heading to the village of Matambe, which is 3 hours away. A woman died there and a swab was taken. The results came out positive with Ebola. Time is short and it is essential to discover and understand how she was infected in order to stop the chain of transmission in this village. Francis and his 2 other colleagues will be interviewing all the people who have had contact with this woman and understand how she got infected. But this isn't an easy task.
So we've got a surveillance team here, and surveillance does a number of different things. It's a big catch-all term. Surveillance has people that do investigations, so they look into where are the contacts, who brought the illness into this village, then what happened to them, who they have contact with. And they're working with contact tracers and the social mobilizers at the same time. So all these people have a relationship with the community. And together, they're interviewing all of the people in the town, trying to find out what really happened, because it's pretty complicated. Like, you know, if someone has brought a disease into the village that's going to affect other people, they don't want people to know it was them. And so there's a lot of shame, there's a lot of reasons that people hide things.
But what we determine...
Yes,
probably, yes. What will determine the... Excuse me. So this is our area of operation, but they are bounded between Podloko district and that of Bombali district. So it's 2 districts. So these are the catchments that are closer to to Podloko district. And Podloko district has been now the hotspot for Ebola, and there have been people who've been positive in that area. And this is the first case for Ebola for Livingston chiefdom in Bombali district. The first case is this. They have never had a case since the starting of this disease onto this endpoint. Now this is the first case of them. Let me just wait it for talk to them, because the more we wait they become frightened. He's presently asking the husband about the link, about how his wife become contact with the deceased. And now he's asking the husband to tell him about if his wife has ever traveled, and he said no, his wife has never traveled.
Thorough investigation, we will not just
the only investigation now this man I'm going to tell you the truth, because that woman don't die now. Now this man I'm going to tell you the truth of the matter.
No, just strangers.
You see,
but people in the camp for community.
Obvious.
You see,
I'm from Gati, they came out because they know their community people in there. You see, I'm from Gati, they came out I am the Tilanwa. I am Katayerbo or I am
presently, now the man we are still asking him and he's still denying. The only thing now he's telling us that the people that he only recalls, they are traders who normally move from Podloko district to came here for selling, and up to this time. So this is what we are still up to have the epilink so that we can get the exact point where this woman got this disease. So we are still asking him, and he said no, his wife is not a trader. His wife doesn't move out of the outside this village. But for now, we cannot establish that fact to be true, since we didn't know the people that are moving out.
Yes, because
we want to know the exact
but if not, they just put us a stranger for specific.
So we are still on it.
Say a stranger within the community.
Give one more time.
You
You might so come on here about one. No, well, Bath a begang. Must work the work meeting. Die. Fine. Can fit at a kilometer per one.
After Francis's team have interviewed all contact persons and crossed information, the story became clearer. The woman who died had traveled to Podloko for business and got infected there.
We're going to be definitely quarantined because all this information was hidden away from us, and these people couldn't tell us since they were afraid. And so that's it, because there are bylaws that whosoever harbor any stranger or visits any burial, he or she is going to be fined. And I guess this is what they are afraid of, and they couldn't tell us the hard fact. But this is the whole story.
We have to trace every contact here so that we can monitor them and stop the chain of transmission here. Because let's remember, this whole outbreak started with one case. One case led to 10,000 cases. This village has never had a case before. This is the first one. And if we can contain it, if we can monitor all the people who had contact with this woman and either treat the people who get sick from her or clear them after 21 days if they don't get sick at all, then we can declare this an area that we've ended that chain of transmission. We haven't let it go any further. And that's what we have to do in every single part of West Africa, is follow these chains all the way to the last point and contain it and stop it there.